Okay, it's just turned 6 o'clock, and if we want to get, well, some of you, we're probably all at home, but if we want to get finished and ready to start celebrating before the match, I think we should get going. Um, just a small housekeeping rule before we start. First of all, welcome. But if I could just ask everyone who is not presenting or speaking, sort of all non-presenters, to please turn off your cameras and to mute your microphones. Microsoft Teams works really well and has done over the past couple of years, but sometimes it can get really slow if everybody has the video on. So it just helps to keep things going and so that nobody has any noise disruption. So once, yeah, I think we're all done that now. So brilliant. Let's get started. It's an hour-long program, so hopefully it'll be informative for everyone who's dialed in. Welcome to the joint annual general meeting of Blackpool CCG and Fylde CCG. And on behalf of Roy and myself, we'd like to thank you for joining us today. It is quite fitting that we have selected this week to hold the meeting because it coincides with the 73rd anniversary of our National Health Service. Whilst under normal circumstances, members of the public would be able to attend our annual general meetings, which I'm sure you'll remember that we've had several good years of that. Government social isolation requirements constitute special reasons for us to be avoiding face-to-face gatherings at this present moment, obviously because of the COVID pandemic. So this is permitted by legislation, which is why we're now able to have this virtually. And it's being broadcast via live Microsoft Teams as well. We did ask members of the public and give them the opportunity to ask questions in advance via our CCG website, and we have received some questions and we will be providing answers to those later on in the evening. Should there be any further questions that arise from any of the business that we discussed today at this meeting, please contact us via the email that I'm going to be flashing up on the screen later on, closer to the end, after we have done the questions. So you can note them down at that time. But as I mentioned, the whole this 1 hour is being recorded so that we can have it on the website as well. So if you missed any parts of this, you can just watch it later on as well. Okay. So the annual report and accounts for the year 2020-2021 for each CCG have been published on our joint CCGs website. The Fylde CCGs, as you know, are responsible for planning and buying health services across the Fylde coast. The annual report sets out the progress made to develop safe, high-quality health services for local people during the year 2020-2021. The COVID-19 pandemic over the past year has encouraged the NHS more than ever to work more closely than ever with local GPs, with patients, with carers, as well as local authorities and our partner organizations to help shape plans for the future. And this remains fundamentally important, especially as primary care and unscheduled care face unprecedented pressures on the health and social care system. We also recognize the continued importance of working closely with stakeholders, the PPG network and the influence panel, many of you who are here present tonight as well, which we really do appreciate your support. So the agenda for this meeting will begin with Blackpool CCG presenting their formal business, which will then be followed by Fylde and Wire CCG presenting theirs. A presentation will then be given by Jane Scattergood, who is the Director of Quality and Nursing on the COVID-19 vaccination program. This will then be followed by Dr. Neil Hartley-Smith presenting about the proposals relating to the system reform of the NHS. We will then share any questions that we received from the general public, followed by the answers to these questions, which we'll do in a verbal format, as you'll see later on. So I'm now going to hand over to the chairman of Blackpool CCG, Mr. Roy Fisher, who will move into the statutory part of the meeting. Over to you, Roy.
Okay, thank you, Adam. I hope I'm not muted. I need to check.
No, we can hear you.
No, I'm not muted. Thank you, Adam. Thank you for that welcome and that introduction. So welcome everybody to the annual general meeting of Blackpool CCG. And I think you all know that we're a clinical commissioning group and we are a clinically led organisation which brings together 17 local GP practices and other health professionals to plan and design services to meet our local patients' needs. Our GP practices serve a registered population of 174,000 patients of a largely coastal area. So I'd like to take this opportunity to thank the governing body members and all the CCG staff, including our commissioning support unit embedded team, for their continued hard work and support over the past year. It has been an extremely challenging 16 months during the COVID-19 pandemic, and the staff have worked tirelessly during this time, so thank you to everyone for your continued support. Now I'll turn to the CCG's governing body membership, and there are a number of colleagues I would just like to mention at this stage. So our thanks firstly to David Bonson. David was our Chief Operating Officer who left Blackpool CCG in January of this year. David gave many years of service to the NHS and in particular the Fylde Coast, and we wish him all the best. And I'd also like to thank Dr. Susan Green, who recently stepped down from the governing body in order to focus on primary care networks and practice work. Susan's contribution to the CCG over the last few years has been invaluable. We send Susan our very best wishes. I now turn to Jane Scattergood, who I know is on the call this evening. And Jane was recently appointed as the Interim Director of Quality and Nursing at the Lancashire and South Cumbria ICS. And many of you will recall that Jane joined the Fylde Coast CCGs in March last year as the Director of Nursing and Quality. And just as she commenced in post, very unluckily, her time was immediately taken up with the COVID-19 pandemic. So during the past year, Jane also took up the additional role of COVID-19 Vaccination Programme Director for Lancashire and South Cumbria. And Jane has worked tirelessly throughout that particular period. So thank you, Jane, for all your hard work and continued support. And we wish you well in your new interim role. Finally, now I'd like to pay tribute to Dr. Amanda Doyle, who's recently been appointed as the Regional Director at NHS England Improvement and will be leaving the Fylde Coast at the end of July. Amanda is with us this evening, and I'd just like to say we wish you all, I'm sure the colleagues who were with us on this evening's meeting would like to wish Amanda the very best for the future and for all the work that you've done on the Fylde Coast. You've excelled at that work, you've brought drive, determination and commitment to the Fylde Coast, and we thank you for that. So we wish you very well for the future, for your future employment with NHS E&I. I know you'll excel within that role and you'll continue to be successful. We'll all miss you for what the work that you've done and the continued work you're going to bring to the NHS in the Northwest. We hope you'll keep in touch and we hope to see you sooner rather than later. So thank you for everything that you've given to the NHS, certainly here on the Fylde Coast, and we appreciate all the work that you've brought. Thank you, Amanda. Adam, would you like to add anything to that? If not,
sorry, I was going to take that when it was my turn. No, I would just echo your sentiments, especially with regards to our colleagues that have left, Susan Green, David, Jane, who is leaving us as well. We've really enjoyed working with you, and you've done a tremendous job for us, and we're really appreciated. We've appreciated all the time we've spent with you. With regards to Amanda, I'm sure she will be successful. She always is, and she's done a tremendous job for primary care and for secondary care here on the Fylde Coast. So, and I'm sure she'll continue to be batting in our corner as well. So we thank you for your services. Thank you, Roy.
Thank you. So we'll move on to the governing body members. Sorry, apologies for absence. I think we have first. So we have received a number of apologies, and they are in the from governing body members, and they'll be recorded in the minutes. So we have the minutes of the previous meeting held on the 29th of September 2020. That was the previous meeting, the previous AGM. At the time, they were accepted as a correct record as the governing body meeting held in public on the 3rd of November 2020 are now presented for approval. So could I ask two members of the governing body to propose and second these?
Yes, Andrew? Chair, I'm happy to propose that these are a true and fair record of the AGM last year.
Okay, thank you, Andrew. Could we have a seconder for that?
Thank you, Chair. I'll second that.
Okay, thank you, Jane. That's appreciated. Thank you both. Okay, we shall move on. So we're now going to move on to then report the accounts for 2020-21, and I will invite John Gaskins, our acting Chief Finance Officer, to present the annual report and accounts for both NHS Blackpool and NHS Fylde and Ware CCGs. John, thank you very much.
Thank you, Roy. So I'm pleased to present the accounts for the two CCGs and the performance against the three key statutory financial targets. Nathan, if you could go on to the next slide, which details those three statutory targets of the revenue control total, cash limit, and the better payment practice code. Next slide, please, Nathan. The slide that you can see there shows achievement in 2021 of the revenue control total target for both CCGs, and that's consistent with 12 months ago, where again those targets were met in both CCGs. Next slide, please, Nathan. Again, both targets, this slide demonstrates achievement in 2021 and in the previous year against those two targets. And in respect to the Better Payment Practice Code, it also illustrates the actual performance against the 95% threshold that we're required to meet in terms of invoice payment. So in summary, I'm happy to report that the two CCGs have achieved their statutory duties for 2021 and received a clean audit report for the period. Okay, thank you.
Okay, thank you, John. So that now concludes the statutory part of the NHS Blackpool CCG annual general meeting, and I'll now hand you back to Dr. Adam Janjua, who's the chair of NHS Fylde and Ware CCG. Adam, thank you.
Thank you, Roy. Over to our statutory business. Just to mention, the clinical commissioning group for Fylde and Ware are responsible for buying healthcare on behalf of its local population, which consists of approximately 178,000 people. We work closely on a daily basis with the 19 GP practices, each of whom make up the CCG's membership. On behalf of the governing body, the Council of Members, and I would like to express our thanks to all the staff of the CCG for their tremendous enthusiasm and diligence over the past year. We would also like to express our thanks to our NHS and local authority partners with whom we have forged strong working relationships, and to our local volunteers and voluntary groups for all your fantastic contributions. I would also like to echo Roy's comments and pay particular tribute to all our staff for their continued support and hard work over the past 16 months, which has been quite a difficult period, both in terms of the COVID pandemic and the need to work differently, working from home, but still needing to keep up the team working ethos. And I have to say they've done a brilliant job with that. And they have shown true dedication in their roles, and this is very much recognized and appreciated. Moving on to the apologies for absence. Apologies for absence have been received from governing body members, and these will be recorded in the minutes. Going to the minutes of the previous meeting that we had on the 29th of September 2020. These have already been accepted as a correct record at the governing body meeting that we held, that was held in public on the 3rd of November 2020, and are now presented for approval. Could I ask for two members of the governing body to propose and second this, please?
Yes, Adam, I'm happy to propose that these are a true and fair record of the AGM last year.
Thank you, Andrew. Anyone second?
Yeah, Adam, it's Jackie. I'm happy to second.
Brilliant.
Yeah.
Thank you, Jackie. Thank you, Andrew. Okay, we will now note these as a correct reflection of the meeting that was held on the 29th of September last year. And I'd also like to thank John, as Roy has, for taking us through the annual report and accounts for both CCGs earlier. Now I would like to invite Jane Scattergood, who will give us a presentation on the COVID-19 vaccination programme. Over to you, Jane.
Thanks, Adam. Good evening, colleagues, and welcome to our guests and members of the public. And thank you to both the chairs for your warm words. That's very much appreciated. Thank you. I'd like to give an update, if I may, on the progress of the vaccination programme. Next slide, please, Nathan. The vaccination programme, as you will have seen nationally, is one of the most effective vaccination programmes that any health system has ever established. There's much to celebrate. It's no cause for complacency, but there is much to celebrate. The link between contracting COVID, serious illness and death is almost severed now, and that's because of the vaccine programme and its effectiveness. The programme began in earnest in about the second week of December on the Fylde coast, and we have scaled up and worked at pace since that time. Next slide, please, Nathan. The vaccine programme objective was very clear. It was guidance from the Joint Committee on Vaccination and Immunisations, which is an existing expert body that advises on all the NHS-provided immunisation programmes. Their clear focus was on preventing mortality and morbidity, so serious illness and death from contracting COVID-19, and therefore phased the rollout of the vaccine programme both to meet the available supply and to make sure that we protected the most vulnerable first, the people who are most likely to become very seriously ill. Next slide, please, Nathan. You'd probably be familiar with looking at these cohorts. People have waited patiently for their invitation to come when they arrived in their cohort. We worked through progressively, starting with people who reside in care homes for older adults, through the frail elderly, people with clinical vulnerabilities, right down through to people aged 50 and over. And in recent months, we've now opened up to the least vulnerable people, people who are well and under 50. And at the moment, the offer is open to anybody over the age of 18 in the UK. We still await guidance from the JCVI as to when and if we might offer vaccination to people aged between 12 and 17. That guidance has not come to us yet, and we await that expertise. Thank you. Next slide, please, Nathan. So on the Fylde coast, we had a number of deployment methods to take vaccine as local and as convenient as possible for our citizens. You'll understand we had a large-scale vaccination centre at the Winter Gardens. Blackpool Teaching Hospital has operated a hospital hub in the early months of the vaccination programme that was supporting health and care staff to receive their vaccine as one of the early cohorts. But in recent times has opened up a citizen offer, which is bookable by the National Solution, and we're very grateful to our colleagues at the hospital for making that happen. We had 7 primary care-led vaccination services in clusters around primary care networks, and 3 pharmacy-led vaccination services. More recently, we've been working with local authority public health colleagues to enable and mobilise a mobile vaccination clinic, the vaccine bus, which complements the offer from the static sites, takes the vaccine very, very local to people, eradicates any inconvenience of accessing the vaccine, any transportation costs or anything that people might experience. We're in the last phases of the whole population vaccination response, and so numbers are smaller now. Those that were very eager to get their vaccine came forward in number in the early months, but now numbers are smaller. And this is where we really need to work extremely hard to make sure that the offer is accessible and acceptable to all our citizens. And if anybody's hesitant, then we can give them all the advice and support that they need to make a positive decision. People who resided in care homes were visited by the care home team, supported by general practice to take the vaccines to them. And also people who are housebound received their vaccinations at home. Thank you, Nathan. A genuine thank you to our partners. This has been a whole system and a whole community effort. We simply could not have vaccinated so many people without the support of general practice, and not just the doctors, but everybody involved in general practice, their administrative support, their nursing staff, everybody at the hospital, community pharmacy and community teams. A huge amount of volunteer hours have supported the vaccination programme, both via our partner agencies like Lancashire Fire and Rescue and from informal voluntary support. We've had a huge amount of support. We simply couldn't have done it. It's been a phenomenal task. And as I say, it's not over yet, but we really, really couldn't have done it without those partners. So a genuine, heartfelt thank you. Thanks, Nathan. We have had some successes. The uptake in the care homes was remarkable. We were able to support residents in care homes and people who care for them and work in care homes very rapidly in December and January to get those very vulnerable people vaccinated very quickly. As I say, there's a significant severing of the relationship between catching COVID and hospitalisation and death. We've managed to mobilise a huge workforce, largely volunteers, but also paid NHS workforce, and that's been remarkable. We have had some supply issues nationally, international politics at play, and manufacturing of vaccines is a complicated business, so there have been some hiccups along the way. And we've had some issues around managing the estate and making sure that the vaccine sites were suitable and clinically appropriate for our citizens. There is still some hesitancy and perhaps some apathy amongst maybe younger people in the population who feel that they're not at risk from COVID. And we do have a lot of work to do with all our partners in general practice and in public health to get the right message and support people to make the right decision. But overwhelmingly, this has been a really successful programme. Thanks, Nathan. I put up the latest uptake figures. These are possibly 2 or 3 days out of date because it moves so quickly. Uptake in the most vulnerable people is really, really reassuring. First dose over 98% for people over 50, and second dose over 94% in Blackpool, and very similar figures for Fylde and Wyre. The lower age groups, the younger people, haven't all come forward yet, or they're not yet eligible for their second dose, and we continue to see those figures rising. Thanks, Nathan. And I'd like to commend to you this interactive map. You can click on an area and see just what the uptake figures are. The slider that Nathan's moving will take you to first doses and then to second doses, and you can really zoom in and home in on a particular small geography in medium super output areas and have a look at what the uptake rates are. And this is updated in real time, so this is yesterday's data. So I would commend that to you, colleagues. It's publicly available, and the link's up on the slides, and we'll share that with you in due course. Thank you, Nathan. So we're looking to phase 3. Phase 3 will be a third dose of a COVID vaccination or a booster dose. It's anticipated we'll do that in conjunction with an offer of the flu vaccine for at least cohorts 1 to 9, so everybody over 50 and with clinical vulnerabilities. We await the guidance from the JCVI, as I say, about our young people, our teenagers. Thank you. And COVID is a novel virus, it's a new virus, but it isn't a temporary virus. We need to learn how to live with it. We're all grateful that we can have lifting of restrictions and all the benefits that that brings to our emotional well-being and our economy. But still, hands, face and space and fresh air as far as is reasonably practicable. Take up the vaccine and we'll emerge together. Thank you.
Thank you, Jane. That was a nice presentation to see that we've made some real good progress, and whilst the UK has made a lot of progress, I'm glad to see that the Fylde Coast is leading the way on that as well. We thank you for all the effort that you've put in, and you and your team as well. And also I'd like to say that on behalf of the CCGs, both the CCGs, Roy and I would like to thank and convey our thanks to all the volunteers that have given their time to support the COVID-19 vaccination program, not just locally, but across the country, without whom I'm sure we would not have had as much a success as we have currently. So thank you to everyone. I would now like to invite Dr. Neil Hartley-Smith to provide an update regarding the proposals relating to system reform in the NHS.
Hi, thank you, Adam. Thank you, Roy. Good evening to all colleagues and members of the general public on the call this evening. I will give an apology in advance. I seem to have picked up a cold today, so if I start coughing and sneezing uncontrollably, I'll be swift to turn my microphone off. But please bear with me. I will try and get through this. Nathan, can I have the first slide, please? So I think it would be useful initially to recap on the structure across Lancashire and South Cumbria. The ICS, or the Integrated Care System, it's a partnership of the NHS, local authorities, public sector bodies, voluntary, faith, community and social enterprise, along with academic organisations, all working together to keep the almost 2 million people who are resident in Lancashire and South Cumbria in good health. Next slide, please. The ICS is broken down into five places. Locally, these places are known as Integrated Care Partnerships, or ICPs. ICPs will typically serve a population of around 500,000 people, and our local ICP on the Fylde coast follows the exact same footprint as the current Blackpool, Fylde and Wyre CCGs. Go to the next slide, please, Nathan. Places are broken down into neighbourhoods, or PCNs, primary care networks. This is where the day-to-day activity of healthcare actually takes place, and a PCN will typically have a population of between 30 and 50,000 patients. The Fylde Coast has 9 PCNs, and all of our general practices across the Fylde Coast are members of primary care networks. Go to the next slide, Nathan. Having this structure provides a foundation that allows organisations that provide care to work together at local, area and county level. The structure allows us to commission services at the ICS, but tailor the offer to individual neighbourhoods via our ICPs. And in doing that, we can learn at all levels about what works and what doesn't work and feed that across the whole area. System, place and network. We are aware that there's been problems with our NHS over the past 18 months or so with the COVID pandemic. It's created a huge burden on us, and we've had to deal with this, and rest assured we are working on items to bring that back into good order. So by working across our ICS, our ICPs and liaising with our primary care networks, we do have plans ahead to try and bring ourselves back on track. But I think we shouldn't underestimate the fact that this is a massive effort that we require at both our general practices, in our hospitals. It will require efforts from our social services and from all of our other allied services. We will get there, but I think we're talking months to a year, maybe even longer, before we see us back completely on track and over this massive bump in the road that we've been had to deal with. Next slide, please. So those of you who follow the news will have noticed in February of this year, the government published a white paper outlining how the NHS will need to change to enable health and care to function more as a singular unit. This legislation will bring about the creation of statutory integrated care systems, and it will also signal the close down of our CCGs, and that will happen towards the end of March 2022. The commissioning functions of CCGs will move into the ICSs, and the legislation which has been present for so long, which inhibits that collaboration between health and social care, will be removed with the publication of the new legislation. Go to the next slide, Nathan. So what do these proposed changes mean to us? The ICS will become a statutory body, bringing together the NHS, local authorities, I should say, and other partners in the area. The current commissioning functions of our CCG will move up to the ICS, and our local ICS will be called the Lancashire and South Cumbria Health and Care Partnership. By being able to work in collaboration with our delivery partners and as equals, we'll be able to deliver the changes to healthcare at a greater pace and with much greater efficiency. The ICS will make funding available to the ICP, which you'll remember is the place, or is basically Blackpool, Fylde and Wyre in our place. And this will facilitate local decision making and provision that's responsive to local needs. The ICS will commission things that are best done once for large populations. So we're talking things like hospital services, ambulance services, things like specialist mental health, etc. Next slide, please. A place we're going to see more of a focus on population health and reducing health inequalities. In practical terms, what we're likely to see as members of the public is a shift from not just treating people when they become unwell, but having a much stronger focus on stopping people becoming unwell in the first place. So this is not just going to involve the obvious things which we've done in the past, such as tell people to stop smoking, cut back on drinking, etc. We're now going to be looking at the other determinants of health which make those differences, such as housing, such as employment in the area, and such as education, and how we can bring on better attainment in our children. There's good correlations between good education attainment and good health. Next slide, please. The neighbourhoods will be our front line. Most of the care which all of us may receive will be delivered through our neighbourhood teams. And it's through this local collaboration, services will be based and built around our local communities, with provision that reflects the need of what's needed in that neighbourhood. So what you might find delivered by a neighbourhood in Lytham may be different to what's delivered in Fleetwood, different to what's delivered in Blackpool. It will be really geared to wrap around that population it serves. Our primary care network teams will expand from not just being our GP and district nursing colleagues who we've all become familiar with meeting with. They will grow to include, and already do include, people like social prescribers who can point people into the direction of alternatives to traditional medicine, such as community activities, etc., which have been shown to be beneficial, certainly with things like mental health. We're also going to be seeing pharmacists, physios, dietitians, paramedics, all working even closer with our primary care network teams, and we'll also see an even closer collaboration with our social care colleagues at network level and neighbourhood level. Now the next slide, please. So we anticipate that the government will bring forward the white paper in Parliament within the next few weeks. Following this, we'll be in a better position to provide more information to our colleagues, partners, and to the residents of the Fylde Coast. If you would like to learn more about this before that, you can log into the website. The website is listed on the page there. It's www.healthylcs.co.uk/integrated care. Next slide, please, Nathan. Focusing more on our local ICP development, I'm pleased to report that following some disruption of that development during the COVID pandemic and the redeployment of our previous excellent programme director who now works in the ICS, we now have a new interim senior leadership team in place, which will see us over the next few months before, and at that point we'll be looking to put longer term colleagues in post. So in that senior leadership as it stands at the moment, with myself as an executive director, my name is Dr. Hartley-Smith. We also have Stephen Fogg, who will act as chair for the ICP. You may be aware that Stephen is also the chair at Blackpool Teaching Hospitals. And we have a new programme director working with us called Pauline Wigglesworth. Pauline has a great deal of experience in local government and has been at the forefront of the local Head Start initiative. Work at our ICS is going ahead to try and develop a common development plan for our 5 ICP areas. But I think that there is a strong acknowledgement that there will be a need for these plans to be adjusted to fit with local need. And that is certainly a view shared by the current leadership team. We have refreshed the terms of reference, the partnership agreements, and with the strategic framework documentation, and all these have now been provided back out to key stakeholders for comment. And work is already underway to work on how we will deliver these population health initiatives locally. And this will involve significant interaction with our population, community engagement, etc. We are really, really keen that all the services we do develop for the Fylde ICP are reflective of truly what we need across the Fylde Coast, and so that the developments reflect the absolute needs of our local population to deliver that care to the right people at the right time and in the right place. Thanks for your attention. Thanks.
Thank you, Neil. That was really useful. I hope people found that informative. As I mentioned earlier, if you do have any follow-on questions, if you just email them to the email address that we'll share with you shortly, we'll endeavour to answer those questions for you as well and clarify any queries. So I'd like to move to the question and answers section. So you'll each in turn see the slide that shows the question that we received prior to the meeting. I thought we were going to have separate ones, but they're all there. So what we'll do is we'll answer them in turn. So I'm going to just read the question out, and then I'll ask someone in the team to answer the question. So the first one's a bit wordy, so if you bear with me. PPGs across the CCG are concerned regarding their role within the future ICS setup and how they will fit into the PCN, fit in with PCNs when many of the networks are not fully represented by an active PPG. What do contractual obligations mean with regards to GPs when it states that each practice should have a PPG? Is it mandatory or not? Evidence shows that some GPs are not supportive of their PPG. So I'm going to ask if Neil, if you're still online. Yes, you are. Yeah. Great. If you would like to answer that question, please.
Yeah, absolutely. Thank you for the question, whoever posed it. It's a really important question because we are really keen that we do develop our strong links, as I've just been saying, with our local communities. There is a requirement and a contractual obligation placed upon GP practices to have patient participation groups. This contractual obligation came about, I think it was in April 2015 when the GMS contract was changed to reflect this. The CCG really values the work and insight that PPGs give us across the file coast, not just in terms of the quality of services in primary care, but in our hospitals and communities too. We do appreciate that PPGs will vary from practice to practice, and that in some respects reflects how GPs find the time to work within those, because every practice operates in a slightly different way, so we can't mandate one way that a PCG will function, just in the same way as we can't mandate, as I was saying before, how all the ICPs should be the same. They won't be. So PPGs will vary from practice to practice. I think at this stage, and I'm echoing what Jane said earlier, during the pandemic, our PPGs have been instrumental in supporting services like our vaccine clinics and providing much needed support to vulnerable members of our community. And the CCG, myself as a resident of the Fylde Coast, really value that. And the CCG will continue to support the development of strong patient participation groups in the future. And speaking from the ICP point of view, I cannot see that aspiration changing in any way. I hope that answers the question.
Yeah, thank you, Neil. Thank you for that. Okay, second question. What percentage ratio and actual numbers are represented for with regards to full-time GPs, part-time GPs, and locum doctors in the CCGs? So I think I can answer that question. It's not as simple just looking at the numbers. As GPs are not as GPs are independent contractors, the CCG doesn't routinely collect this information. Instead, we at the CCG aim to work with practices to ensure that the staffing mix is appropriate so that they can best manage patients' needs. And practices do tend to employ a range of clinicians that ensure that patients have appropriate and timely care. So just to give you an example of that, you may have a practice that may have a couple of GPs and quite a large team of advanced nurse practitioners, or even a pharmacist that is clinically trained to manage patients. That doesn't mean that that practice is understaffed when it comes to just GPs, as it's the whole team that manages the patient workload. And in some cases, there's a big bulk of work that's being done by the advanced nurse practitioner team as well. And they do a tremendous job that helps the whole of primary care actually be able to see the patients that we encounter on a day-to-day basis. So I hope that answers the question. I'll move on to question 3, which is there a list of medical procedures that GPs carry out, for example, ear syringing, blood testing, etc.? If not, can a list be drawn up? To break the monotony, I'm going to ask Neil to answer that. Neil?
Yeah, thank you, Adam. I think the short answer, is there a list? No. Could one be drawn up? Yes. I think this is where we just need a clearer understanding, though. The two services mentioned, ear syringing and blood testing or phlebotomy, when we actually break this down to what the GMS contract core services ask us to perform as general practitioners, those are not included within that core list. So I think that does give our public at times some confusion over what they should be receiving and what they shouldn't be receiving. Up and down the country, CCGs will work with local independent contractors or GP practices to work on what we call local enhanced services. And we're no different in Blackpool and in Fylde, where we do have local enhanced service contracts, which often work, well, which do include the procedures that are being mentioned here. So absolutely, that list that is included on the local enhanced service contract can be published with the minutes of this meeting. And I do hope that answers the question and hopefully dispels some of the confusion that can happen around what people think they should be being provided from the general practice.
Thanks, Neil. I'd just like to add to that it may be worthwhile noting that some of these services or procedures have been paused during the COVID pandemic, so that GP practices sort of were able to deal with all the increased workload of the COVID that came along with the pandemic itself. And I'd also just want to add a little bit of a caveat with regards to, we can publish a list of blood tests that you can have at a GP surgery, but at the end of the day, it's always going to be a clinical decision of what blood tests that are appropriate for a particular person. So just because there is a list that exists, that does not mean that you are automatically entitled to have those blood tests. That is going to always be at the discretion of the clinician, unless the specialists have asked the general practice surgery to conduct a series of blood tests on their behalf, in which case obviously they will be done. But it isn't just a simple procedure of having a list and then sort of mapping it out to what you have an entitlement to. That is a very different thing. So not to be confused with sort of just looking at a list as such. But I think Neil and I have answered that question. And obviously, if there are any follow-up questions, because these were the three that we received. If you do have any follow-up questions, if you just note down the email address to the comms.fylecoast@nhs.net, we'll endeavour to reply to the questions with our answers within a few days, and also post the questions and the answers on the website as well for those who could benefit from reading the answers as well. Before I hand over to Roy for the closing remarks, I think it would be pertinent to just ask Amanda, as she has been a big presence on the Fylde Coast for many years in the sort of health commissioning and health provision as a GP as well side of things. And I think it would be a tragedy if we didn't just get Amanda to say a couple of words before we finish today. So Amanda, if your connection's all right, if you could just
okay, thanks.
You have the floor.
Thank you. I agreed to do this only if there was time. I'm conscious people have got a football match to watch. First of all, I want to say a huge thank you to all of the team, all of the staff, the exec team and the governing body for their contribution over the last year. It's been probably the most difficult, challenging time any of us can remember. It's really hard maintaining all of the day-to-day work and management of a pandemic when people aren't allowed to congregate in groups and work in teams the way they normally do. So people have really gone above and beyond, and I just want to thank everyone for that. You've all been amazing. I came to Blackpool to do a 12-month job in 1991, and 30 years later I'm still here. So it is a bit of a wrench to be leaving the Fylde Coast, but it's been a fantastic experience, a fantastic place to work. I've worked with some great people, some of them for more years than I care to count. I'm really looking forward to moving on to be the Regional Director for NHS England and Improvement, but it still is a bit of a wrench to go, so thank you. It's been great. We've done some really good stuff. We've really, I think, between us all, done the best we can in the place with some of the most challenging health outcomes in the country. People have been really, really positive and worked in a way that really has demonstrated what this integration is all about. So thank you, everybody. Thank you for the last year and all their efforts. And it's a bit of a wrench to leave.
Thank you, Amanda. And we obviously wish you the best of luck. And I don't think we'll not see you again, because you'll be looking after the NHS for the whole of the North. So we expect a bit of favoritism when our time comes. Before I hand over to Roy, I just want to say a special thank you to Nathan, the comms team, Amanda, and Louise for putting this together at fairly short notice, and having done a tremendous job. They're the reason why Roy and I and the others look remotely competent today. So they've done a brilliant job. So thank you guys for that. I'm going to hand over to Roy Fisher now, and to everyone who's attended. On behalf of myself, at least, thank you very much for your interest and your time. Roy, over to you. Sorry, Roy. Yeah, I think you're muted. No, still muted.
I was muted because I was coughing before, and Neil was suggesting he caught a cold today, and I think I have as well, but I didn't know you could catch it over the internet. So anyway, I'd just like to join with you, actually, Adam, in thanking the people who put this presentation together today and the annual report, all the people in comms, and as you say, the people in administration, and the names that you've said there, Louise, Nathan, and all the others. So thank you from me as well, on behalf of Blackpool CCG. So thank you to everyone for joining us today, particularly under these unusual circumstances, particularly members of the public as well. We appreciate it joining us on our AGM. Hopefully we'll see many more of you when we're able to open up to normal AGM, our normal AGM, where we have it in one of the NHS buildings around Blackpool or on the Fylde coast. So when we do that, we hope to see you probably in greater numbers, but we really appreciate you being with us tonight. So I say thank you for joining us. It is unusual to do this on this media and by the internet, but we do wish you all to keep safe, well, and I now declare formally that this meeting is closed. Thank you all.